cholesterol can be lowered without medication. Many patients who come to see me with high cholesterol tell me that they don't want to take statins since these drugs have a number of contraindications. In this video, I will share with you some tips on how to lower cholesterol without medication. My patients with high cholesterol get the following results. Let's figure it out what cholesterol is and where it comes from in our bodies. 25% of cholesterol enters our body with food, and only with food of animal origin. Plant products do not contain cholesterol, and 75% of cholesterol is produced by our own body, mainly by the liver. It is a component of hormones, vitamins, cell membranes, and bile acids. There is an enzyme in the liver that is responsible for cholesterol synthesis. This specific metabolic enzyme is typically most active at night, and it is activated by the presence of insulin in the bloodstream. If we eat at night or in the evening, we provoke the production of insulin. Insulin activates this enzyme, which affects cholesterol synthesis, and thus cholesterol begins to be synthesized in the liver at night. There are different types of cholesterol: high-density lipoproteins, low-density lipoproteins, and very low-density lipoproteins. The liver synthesizes only low-density lipoproteins. But if we don't eat before bed and at night, practice intermittent fasting, and begin to feel the sensations of hunger during the nighttime hours, an intracellular enzyme called AMPK will become significantly more active within our bodies, and it, in turn, blocks the activity of the enzyme responsible for cholesterol synthesis in the liver, and thus cholesterol is not synthesized in the liver at night in the same volume as it can be synthesized by our bodies if we eat before going to bed and at night. And from here we understand that the key factor in cholesterol synthesis is not what we eat, vegetables, fruits, or meat, but when we eat and how much we eat. When our cholesterol rises and we remove all fats and fatty foods from our diet, this only helps to normalize about 20 to 25% of cholesterol. The second point: cholesterol is synthesized in the liver, and it needs to enter the bloodstream. Since the liver produces only low-density lipoproteins are released which have a protein fraction on them, like a little lock, let's say, called apolipoproteins, specifically apolipoprotein B, and this apolipoprotein B acts like a lock, searching for a cell. Individual cells are equipped with specific receptors for apolipoprotein B, and the various cells that require cholesterol engage in a complex interaction with the cholesterol found within low-density lipoproteins through this apolipoprotein B. The cell takes and utilizes the specific amount of cholesterol it needs, and any of the remaining cholesterol is then efficiently transported back to the liver for processing by high-density lipoproteins. High-density lipoproteins have the same kind of protein lock on top, apolipoprotein A. Apolipoprotein A goes to the liver, where there are receptors for apolipoprotein A, which are used by the liver for the synthesis of bile acids. In the lumen of the intestine, specifically the small intestine, they are reabsorbed and enter the bloodstream again, and through the blood they return once more to the liver. And this way cholesterol circulates constantly in our body. And in people who have hereditary hypercholesterolemia, cholesterol enters the bloodstream and cannot find the right cell, so it circulates there and accumulates. That is why their blood tests show elevated levels of low-density lipoproteins. Why is everyone trying to lower their cholesterol? Because cholesterol, especially low-density lipoproteins, is the main factor in atherosclerotic changes in blood vessels. That is, the formation of plaques. So how can you lower your blood cholesterol levels? The first step is, of course, to look at your diet. Reduce the consumption of foods that contain cholesterol, that is, foods of animal origin, precisely animal fats and proteins, pork, veal, young lamb, beef. The second step is to create a negative energy balance. In other words, eat less than you expend. And as you already understood, do not eat at bedtime. Thirdly, consume fiber. Fiber is coarse plant fibers. It can be fermentable or non-fermentable. Fermentable fiber is the type of fiber that serves as food for our gut bacteria and is fermented by bacterial enzymes. In our case, to lower cholesterol, non-fermentable fiber is more suitable. What we need specifically to lower cholesterol is soluble non-fermentable fiber. This includes natural psyllium husk. Psyllium is suitable for everyone because it is non-fermentable, soluble, and does not produce gas. Of course, you can also consume fermentable fiber, but it is not suitable for everyone because for some people it causes gas formation. How does fiber help lower cholesterol? As I mentioned earlier, there is an enterohepatic circulation, meaning cholesterol is released with bile into the intestinal lumen and is absorbed in the small intestine. Once it has reached the interior of the small intestine, soluble fiber begins to swell up and effectively binds to and absorbs these bile acids together with the cholesterol and safely eliminates them from the body. If this happens regularly, the liver has to increase its receptors in order to draw more cholesterol from the blood, and thus the level of low-density lipoproteins in the blood lowers. Further, visceral massage stimulates blood circulation in the organs of the abdominal cavity, including the digestive organs and the liver. This, in turn, leads to a slowdown in the synthesis of low-density lipoproteins in the liver. The use of omega-3 fats and foods containing omega-3 lower cholesterol. It is believed to reduce cholesterol by 20 to 30%. Foods containing omega-3 include seafood, fish, all kinds of fatty varieties, and so on. It is important to emphasize that if you use omega-3, it starts to work only after taking it for 3 or more months. If you take it for just a few days, of course, it will not work. Omega-3 helps reduce the synthesis of low-density lipoproteins in the liver, as omega-3 affects the activity of the enzyme responsible for cholesterol synthesis. As you've already understood, it is necessary to monitor your blood cholesterol level and to keep it within the normal limits. This is very important for our blood vessels, which means it is also very important for our heart, brain, and all organs. Our body is a holistic system, and it doesn't function based on just one thing or one rule. So we need to take a comprehensive approach to our health. After all, there's a reason people say that doctors treat diseases, but health is a personal matter for every person. Please write in the comments whether you monitor your cholesterol level and what you do to lower it.